Today, we will discuss first-use syndrome, which is an acute hypersensitivity reaction that can occur during the first use of a new dialyzer. Although this reaction has become less common with the development of modern, biocompatible membranes and safer sterilization methods, it remains a critical issue in dialysis care. It is important for all dialysis staff to be able to recognize it quickly and manage it appropriately, since it can become life-threatening if not handled properly. By the end of this lecture, you should be able to 1. Define what first-use syndrome is. 2. Recognize the clinical manifestations associated with it. 3. Explain the pathophysiology behind this reaction. 4. Outline management strategies when it occurs. 5. Review preventive measures. Finally, summarize the key safety points, especially the critical reminder to stop dialysis and never return the blood. First-use syndrome is an acute reaction that occurs when a patient is exposed to a dialyzer for the very first time. Historically, this was most often linked to ethylene oxide, or ETO, which was commonly used as a sterilizing agent. Even trace amounts left on the dialyzer could trigger severe reactions. With the use of newer sterilization techniques and more biocompatible membranes, the frequency of this syndrome has decreased, but it has not disappeared. That is why dialysis teams must still be alert to it and respond quickly when it happens. The main causes of first-use syndrome are twofold. First, exposure to residual ethylene oxide sterilant, and second, complement activation by older cellulose-based dialyzer membranes. Both mechanisms lead to activation of the immune system. This activation results in the release of histamine and other inflammatory mediators, which in turn cause the symptoms we see in patients, ranging from mild reactions like itching to severe, life-threatening reactions like anaphylaxis. The reaction usually occurs within minutes of starting dialysis. Patients may complain of chest tightness, difficulty breathing, or wheezing. They may develop back pain, flushing, itching, or hives. Hypotension is common. In the most severe cases, patients can develop full-blown anaphylaxis, which is a medical emergency. Because these symptoms overlap with other causes of intradialytic reactions, it is important to keep a high index of suspicion when symptoms occur during the first use of a dialyzer. The diagnosis of first-use syndrome is mainly clinical. The key clue is the timing. Symptoms develop soon after the start of dialysis with a new dialyzer. However, we must also rule out other potential causes of acute reactions, such as contaminated dialysate, bacterial endotoxin exposure, or even an air embolism. Recognizing the pattern of onset in the right context helps us distinguish first-use syndrome from other dialysis emergencies. Management must be immediate. The first step is to stop dialysis at once. The second, and most critical safety step, is never return the extracorporeal blood to the patient. This blood contains the very agents triggering the reaction, and reinfusing it could worsen the reaction dramatically, even leading to anaphylaxis. After stopping dialysis, support the patient's airway, breathing, and circulation. Provide oxygen as needed. Give medications such as antihistamines for itching and urticaria, corticosteroids to reduce inflammation, and epinephrine if there is severe reaction or anaphylaxis. Finally, document the event clearly and flag the patient's chart to prevent recurrence. Prevention focuses on careful preparation of dialyzers. Always rinse new dialyzers thoroughly with saline before use. In patients with known sensitivity, avoid ETO-sterilized dialyzers and instead use dialyzers sterilized with gamma radiation or steam. Label high-risk patients' records clearly so that the entire team is aware. With these simple but consistent measures, most cases of first-use syndrome can be avoided. To summarize, first-use syndrome is an acute hypersensitivity reaction that occurs during the first use of a new dialyzer. The main culprits are ethylene oxide residues and complement activation. Symptoms include chest tightness, dyspnea, urticaria, hypotension, and in severe cases, anaphylaxis. Management is straightforward but crucial. Stop dialysis immediately and do not return the blood. Provide supportive care with oxygen, antihistamines, corticosteroids, and epinephrine if necessary. Prevention involves proper rinsing of dialyzers and using safer sterilization methods. The take-home point is simple and life-saving. First-use syndrome is a dialysis emergency. Always stop dialysis and never return the blood. That wraps up today's video. Thank you so much for watching. I truly appreciate your time and support. If you found this helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future content. More videos are coming soon, so stay tuned.